So do you know if your hips are tight or if your core is weak? Do you know the difference and do you know how to tell? Well, I'm going to teach you on this week's Monday Moves with Marian. Hey there, it is Marian. It is Monday. I'm so happy to see you because we are talking about one of my favorite subjects, and that is the core. I love the core. It is so important, and you need to know that it is not just about your abdominal muscles. So I'm going to show you a little exercise. We are going to determine with this exercise whether or not you've got tight hips, whether or not your core is doing what it should be, which is stabilizing your position, or maybe you win and have both as an issue. Well, you know what? That is the number one thing. We've got to figure out what's going on, because if you don't know, you can't fix it. All right, so I want you to first take a look and see how you're standing. Are you standing in your natural posture? And what is your natural posture? Are you even? Are your feet in alignment, heel toe? Do you have your pelvis even? Are you sort of, leaning to one side or the other? Do you have one knee locked and one knee bent? Can you see that your shoulders are uneven? No, of course not. That's not what you do. That's what I do. So you're not going to know if you have imbalances. You're not going to know what the problem is. So that's why I'm going to teach you this simple little way of testing. So I want you, eyes on my feet to start with. We are going to have these aligned, heel toe, both sides, hip width apart. I don't want you too wide. I don't want them touching together. I want them at a nice neutral posture. Now I'm going to start on my left foot here, and I'm going to use the heel as the pivot. So the heel is going to stay in place, and all I'm going to do now is slide the front of my foot out to the side. Slide it as far as you can. I don't care how far it is. I don't care on the results. I'm caring on how you're moving. Remember that. It's how you move. So slide that foot out, and now we're going to do our check. Check that that belly button is pointing straight ahead. Or did it want to rotate with the foot? If it did, bring it back. And if you can't, slide that foot in a little bit. So let's come back to neutral and let's do that on the other foot. So check for our alignment, and you will be surprised. You will be surprised that you're going to think that they're in alignment, that they stayed there, but they did not stay in alignment. They will move. So I want you to check that alignment, and now with the other foot, pivot from the heel, slide those toes out, and then check that you are neutral. Now, as you're holding this position, as you're determining where that foot is, where that belly button is, I want you to think about where you're feeling that. Is that tight in the back, in that glute area? Is that pulling through the front? Do you feel your core engaging? If you're not sure, here's what you're going to do. Check the foot position, and now ease off on the belly button. Just let your body go where it may naturally want to go. Then try to bring it back to neutral. That is the belly button forward, hips aligned, shoulders aligned, and your foot out on that angle. Now tell me, where do you feel that working and trying to hold that position? You may feel it in all sorts of places. It could be the core trying to work to hold you in place. It could be in your quads trying to set to keep this foot stable, because remember, you're working stability here. You've got hip external rotation on that side and the core holding you in the middle. So this is an amazing little exercise to not only dissect what's going on with your body, but for you to work on engaging different areas that should be working together. Your foot alignment, your hip positioning, your stability, and your core are all part of a sequence that works without us even thinking about how that happens. But when it's off, when they are not working well together, is when we start getting problems with hip pain, with low back pain, with knee pain, or with foot pain. So that's what we want to check. Again, I love to combine functional movements, and here's the key. If you cannot work on parts of this, if you're finding it too difficult, if you can't get that belly button aligned, if this leg won't stabilize, then you know that you're not ready for this exercise. You're going to go back in the lower levels of our Foundations First framework and work on these activities. And that's why I would love for you to jump in and grab your copy of the Breast Cancer Guide to Pain-Free Walking. It will take you through the steps from the ankle movement to the knee movement to the hip movement, so you can dissect and figure out where you may be having issues with mobility. If you don't know what's wrong, how are you supposed to fix it? I don't want you trying this and trying that and saying, oh, this didn't hurt and this did hurt. I want you to try and say, I can't do this. I know what I need to work on, or I can do it. I'm going to graduate to the next step. That makes me happy because then I know you're working on form and I know you're working on how to do something, not just to get it done. And that's most important. So did you have any aches? Did you have any burning? Did you have any pain? Were your hips fighting you? Was the belly button flying off to one side or maybe to another? Was one side really good and the other side imbalanced? That is a telltale sign where there is weakness and strategies that you really need to implement to keep you balanced on both sides. Imbalances between sides is one of the biggest risks for injuries. So it's certainly something I want you to take care of, something where I want you to level back, figure out what's not moving properly, and make sure you work on those foundations first before you start getting into the points of stability and getting into your cardiovascular and working on your endurance. We need to set that solid foundation so you have all the tools and working at your best potential so you can move yourself forward to the activities that you love. So I want to remind you, if you are having tightness in the hips, if that may be pulling in the knees or you find it really difficult to keep your feet in that position, then go grab your free copy of the Breast Cancer Guide for Pain-Free Walking. It's going to talk you through exactly how you should be checking out those ranges of motion that you need to make sure you've established those foundations. And I want you to hit the subscribe button. I want you to be part of my journey as I'm teaching you the techniques and trainings that I use with my patients to make sure that you get to your best potential. So have an awesome day. I hope to see you soon.